Hey, good afternoon. It's your afternoon girlfriend, Yvonne Daniels. Happy Tuesday. Hope you're having a great day. And thank you so much for joining us for this very special live that we're doing, this live stream. And of course, we're doing this with the Saginaw County Health Department, doing it for Big Ma. I've got Dr. Delisha Pruitt, who is the medical director for the Saginaw County Health Department with me. How are you doing this afternoon?
I'm doing great, Yvonne. Thanks so much for having me.
Man, just thank you so much for joining us. And, uh, as we get into this, we are what it is October 13th. And man, it has been probably about probably going into the eighth month now of this pandemic that was supposed to only last for 2 or 3 weeks. And so we are continuing to push through. Um,
Yes.
and we've heard about the disparities, for COVID-19. We've even had a president to be diagnosed with COVID-19 who says he's now cured. But there's still so many things in our community that we're having to deal with COVID-19 and just, the disparities that we're hearing about. So we're just going to dive right into this because we're doing it for Big Ma. And, I was telling you about some commercials that I was hearing about young people. Young people were in the commercial talking about the parties they had gone to and that they felt like they had caught it and spread it to the entire house. And we know in a lot of our homes, there are older people that are susceptible to COVID-19. So just going to start off with, when it comes to COVID-19, we're seeing that racial disparity too that we've been just constantly hearing about. And we're seeing it here in Saginaw County. So are our Black and Brown communities more heavily burdened by the pandemic, do you think?
Yes, they are. When you just look at the state of Michigan, we make up 14%, African Americans make up 14% of the population, but we make up 40% of the deaths in the state of Michigan. Think about that.
Mm-hmm.
So when they talk about a disparity, they're talking about the difference in care or treatment or illness burden. And African Americans have a higher illness burden. If we look at Saginaw County at one time, we were making up 30 to 35% of the cases of COVID-19 and 30% of the deaths,
Mm-hmm.
even though we were only 20% of the population.
Wow.
So right now we've done a better job. We've been really working hard to reach out to Black and Brown communities to let them know that you are at risk and that you have to take this seriously. And so the thing we want you to know now is that we've been working hard to kind of reach out and say, hey, we are all dying, Black and Brown people, at a higher rate. It doesn't mean that white people aren't dying because they are, and it's a large percentage of people who die, honestly. But for the percentage of us who actually live in Michigan, there are more deaths from us than there are from Caucasian Americans.
Wow. So, with you having said that, why do you think that is? Is it access to testing? Is it access to healthcare? I mean, what is it?
One of the things we were proud of here in Saginaw from the very beginning is that we started testing early. And one of the things that happened was the health department reached out to Covenant, St. Mary's, Great Lakes Bay. We all came together and supplied testing for this area. So right now with Great Lakes Bay, you do not need a physician's order. You could just drive through at the Great Lakes Bay, 501 Lapeer Street, and get tested. And so you can go to any hospital and get tested, but it has to be with the physician's lab order. Great Lakes Bay, no lab order. And on State Street at Rite Aid, you can get tested 7 days a week at State Street Rite Aid. So it wasn't really testing. A lot of times it's access. One of the problems that we realized was that for people who had no insurance, or who had no primary care provider, that was a loophole in our system when we had testing in this area. So Great Lakes Bay just kind of picked up their hand and said, we'll take these people. And so anyone who doesn't have a primary care doctor or don't have insurance can get tested at Great Lakes Bay. In addition to being tested, you could also get yourself a primary care provider at Great Lakes Bay that way. They also take people with insurance, so I don't want to miss that either. And also we have neighborhood testing sites in the 48601 area code that you can get tested. But access to care is some of the issues in this area, although our federally qualified health center, Great Lakes Bay, does a good job with that. And then one of the problems is a lot of brown and Black people are critical infrastructure people who work in those areas that require people to go to work and have a lot of interaction with people. For instance, food service, grocery stores, those things like that. Even in the hospital, you have a lot of people who have interaction with a lot of people and do different jobs in the hospital.
Right.
That puts us more at risk for COVID-19. And finally, Yvonne, if I could say anything, it's the chronic health conditions.
Wow.
Those are the ones that put us in trouble. And I'm looking for you because they're diabetes, high blood pressure, coronary artery disease, people who have stroke, people who are obese. Obesity is the number one risk factor of all of these other chronic conditions to work on. That's something that we really, really have to work on in our community.
So, you know, and I'm the kind of person, I like knowing that there is something that can be done, that we do have power, you know, within ourselves to change some things. And so that's what it sounds like you're saying. And so what can our community, our minority communities do to kind of minimize these risks? You know, I've heard you talk about the three, I hear you all the time on the radio talking about those 3 W's. So just kind of tell us about what some of those things are that our communities can do to kind of minimize these risks.
So the first thing I want people to know is that if you have a chronic condition, I want you to stop, go to your doctor and talk to them about your chronic condition. I want you to say, what can I do to get better at this? Because chronic conditions not only make us at risk for COVID-19, it makes us at risk for a lot of things other than COVID-19. All they do is get progressively worse over time. First thing you want to do is talk to your doctor. The next thing we have to do as a community is eat better. Now, I get it. We like the things that we like, right? I mean, you know, if you grew up eating ham hock and your greens, you're used to that. But you gotta find a different alternative because food shouldn't be the thing that kills us. I can tell you that losing weight is one of the hardest things that I had to do because you know what happens when you get into a stress kind of pattern, you just start eating, or you go back to what you're used to doing, which is bad stuff. When you really get stressed out, you're like, give me some chips, give me some crackers, give me some cookies, that kind of thing. You really have to start dealing with yourself and say, I'm going to use food as something, as a nutrient to help me be healthy and grow, not as something to deal with my emotions and feelings and things like that. And so we need to start using food the way it's intended to help our bodies. We need to eat more healthily, and then we need to exercise. I grew up on the south side of Saginaw on Grant Street.
Okay.
We ate like everybody else. We ate dinner. So when I, got older, I moved on in the township, and I watched everybody in my neighborhood walk around the neighborhood after dinner. And I'm like, what are these people doing? And I was like, why are they all walking outside? So I told my husband, Brian, like, okay, let's go outside and walk and see what's going on. And I realized that certain cultures have a pattern of exercise. And I asked one lady, why do you walk after dinner? She said, it just helps you digest your food better. And studies show that if you walk 30 minutes a day for 5 days a week, that's 150 minutes in a week's time, that reduces the risk of a lot of diabetes, high blood pressure, coronary artery disease. And if you lose 10% of your body weight, that also reduces your risk of making these conditions worse. If you weigh 200 pounds, that's like if you lost 20 pounds, that's it. It can make the obesity better. It can make chronic conditions better. So we got to deal with our food and our exercise to deal with these chronic conditions. So you got to go to your doctor, get on a diet, exercise, lose your weight, and take your medicine as prescribed. Yvonne, this is the thing that kills me. Our people, I love us, we like praying and we like believing and we like doing everything. But I say you need to pray and believe to eat right and exercise. If you're going to pray and believe, because everybody wants to stop their medicine. But every time you come in heavier. You got to pray and believe to get your mind right when it comes to food, because this is what helps us with COVID-19.
And food is medicine, It is. And like you said, a lot of the ways we cook it, it's just not good for us, So we definitely have to do better. And I believe that we're going to. I believe that we're going
We
to get.
are going to.
Yeah, we have to. We got to. We have to.
I'm
So
starting something called Walk with the Doc, and it'll
yeah.
be on our Facebook Live, and I'll get it out so everybody will know. But we'll be online, and you can join us Facebook Live, and you'll be able to walk with us while we talk about nutritional things.
Yes. Oh, that is so cool. That's
Yeah.
cool. And I know that on the radio too, they had like I guess it's like a bike club where they meet, you can bring your family and, go riding. So all that kind of stuff is so good. It just keeps that blood going, like you said, it helps you to lose weight and all of that. Like you said, it's going to help with the underlying conditions, and it's going to help to prevent, I think, getting coronavirus and COVID-19. So
Yes. It makes a big difference.
So now we've tackled that, and it's something that you and I were talking about earlier too. These young folk, young people. So what would be the message that you would tell to a 20-something? Why should they be concerned? Since and it really does seem a lot of them don't seem like they're that they can get it. They're not concerned about getting exposed or getting sick. What would you say to these 20-something folks out there with that thinking?
Yeah, so like when we first started with COVID-19, we used to tell people, oh, it doesn't seem to affect young people. And now we do know that it actually does affect young people. Now we have a 25-year-old on our Facebook Live who talked about having COVID-19, and he got it, and then his fiance got it too.
Wow.
And one of the things he really stressed and he wanted everyone to know was he knew he wasn't going to die, but he said, I am definitely suffering. This is not something that you just go out and just say, if I get it, I get it. That's great. It's becoming more and more complicated. It is even starting to affect young children. And so there's something called multi-system inflammatory disorder. It is rare. It's more common in African-American children. And what happens is after the kids get COVID-19, about, I would say, 7 to 14 days later, they start having this big immune response. And these kids have been on vents. Some of them have died. So it does affect younger children. Now, these girls, they may not die, but what we don't want you to do is to take that home to your mother, father, grandmother, grandfather, aunts, uncles who are older, and then they die. So this is what's behind our Do It for Big Ma campaign. We want people to know that we want you to do it for yourself.
Yeah.
And if you don't have enough strength inside of you to do it for you, we really want you to be able to say, do it for your grandma, do it for your granddad. Because if you can't, we don't want you out mingling and having fun, not wearing a mask, just being willy-nilly. You need to really take this seriously because our community, brown and Black people, are dying.
Yes, for sure. This thing is real. We've seen it. Over 200,000 people that have died in our country from this. So and numbers are still going up in some places, are starting to spike back up. So this thing is real. And for your family, they are blessed to have someone like you in the household with all the information, knowing what's going on. But, for a lot of people, it's hard to know what's true and what isn't. So where do you think people should go for that trustworthy information about all that's going on with this?
We at the Saginaw County Health Department, we have a website. So if you go to if you just put in a search in Saginaw County Health Department, it'll pop up and you'll see information about coronavirus. You can go to the CDC and good information about coronavirus. And then MDHHS, which is the Department of Health and Human Services, you go there and they have a corona page where pages where you can learn a lot about coronavirus. I know that when you talk about coronavirus, sometimes things change. We let people know that this is a novel virus. And the reason why they say novel is because it's new. We've never had to deal with this specific virus before. There are other coronaviruses that we've had to deal with, but this one is different and it does different things. So we tell people all the time, don't get frustrated when we change our mindset or ideas about certain things. Some people say earlier on, they said, don't wear a mask. And now they're saying wear a mask. That's because the more we learn, then we do better. When you know better, you do better, right? So the more we learn, we say, okay, we might change it a little bit. And I tell people all the time, despite what, if the CDC puts something up and then take it back down and they say they want to change it, that's fine. We need to be smart in our community. We need to make sure we maintain the 3 W's. And we talk about this all the time. You want to wash your hands. You know what happened? Your grandma, you come from outside and you walk in, what your grandma say? Did you wash your hands?
That's right.
Touch nothing. My hands was in my pocket the whole time. She said she didn't care. Go wash your hands. We got to be that like diligent and I don't know what the word I want to say, just diligent about washing our hands.
Yeah.
You want to be washing your hands over and over. When you come outside, you touch things, wash your hands. And then I'm not 100% sure why there's even any discussion or fight about this. We need to wear our mask. Okay? Wear your mask. Oh, what does the mask do? The mask stops around 60-70% of the respiratory droplets that come out of our mouth. So if we sneeze, if we cough, I always say, how we always say when we were little kids, say it, don't spray it. There's something to spray when they talk, right?
Right.
So what it does is block all of this here so that you don't give it to someone else. The problem is, if we're a selfish individual, we won't wear our mask. But then I'm wearing my mask. You don't wear yours. I'm protecting you. You're not protecting me. What's up with that?
Right.
That's being a good citizen, right? Of Saginaw. We want to be able to protect each other. I wear my mask. You wear your mask so that you can block those respiratory droplets from getting to me. I block mine from you. We're doing well.
Yeah.
And then finally, we want to watch our distance. We all know that COVID-19 can go 6 feet. Possibly even more. So if you have a great conversation with people 6 feet apart, then you can watch that distance. You don't want people standing close to your face so they can just kind of give you COVID-19. You want to stay far apart. We all can do that because that's easy. That doesn't take a degree of thing.
Right.
Being persistent, being focused on making sure that you keep that distance, wash your hands, and wear your mask.
Three easy things that we can do, like you said, that would prevent 60 to 70% of it right there. So
right there.
All right. So, folks are saying that this COVID-19 is going to go away after the election. What do you think? Is this going to go away like folks are saying it is?
Guys, this is here to stay. And I'm it is here for a little while. We still have to get our vaccines available. We got to get things together. This thing, if it was dependent on election, then it probably wouldn't come from China, right? Because then it wouldn't even come here. It's not about politics. This is about now a virus that's across the whole entire world.
Yeah.
This doesn't depend on an election or anything. This is something that we didn't anticipate. We can't control no matter who wins the election, it's still going to be here, and we still got to do our job to protect ourselves. We don't want to let being polarized, being on opposite sides of one thing or other, help us not to think clearly and be smart about protecting ourselves. This is not about an election. This is about a pandemic, something that went across the world, that's still across the world, and we got to be smart and protect ourselves.
Got to do it. Well, Dr. Put, I thank you so much for I've just been hearing you all over the place, and thank you for the diligence that you have about getting the information out, especially to our Black and Brown communities. Just appreciate you so much. And so, I want to know, what can we look forward to from the Saginaw County Health Department? Any mobile services, or what do you guys have that's coming up?
Yeah, so we're so excited because we have just purchased a van. And we're going to be taking mobile services to all parts of the county to make sure that we get more testing. I don't know if you guys have a chance. I want you to look at some of our Facebook Lives, because we talked about some of our nursing services here. We talked about our laboratory services here, our food inspection services here. We even do hearing and vision screening for all kids in school. So we want to take some of our services on the road and take them to the people instead of the people having to come to the health department. So that includes immunizations, nursing services, and COVID testing, and even other testing that we do here. We do urine drug screens and all other kinds of testing here. So we want to take our services on the road to you guys so that you can really know. I want to say, Yvonne, that a lot of people don't know how much the health department actually interacts with them, even though they don't know what we do sometimes. Do you know we do food inspections? So we make sure that we do restaurant inspections. We make sure that if we have an outbreak in a restaurant, like in the past, we had a Cracker Barrel hepatitis A outbreak. We take care of those type of things. We also do hearing and vision screening, like I said, for all the kids. My own kids, I didn't even know that they were having vision problems, and the health department came to their preschool, did vision screening, and both of them wear glasses, and I didn't even have any idea. So we have a lot of things. If you have well water, we test that. We test swimming pool water all across the county to make sure that swimming pools are safe. So these are all the things that we do at the health department, and some of those services we're going to take out on the road.
So with you all taking those services out, and you go somewhere and you have these tests for people and things that they can be a part of, will anything be needed? Will any insurance be needed? What will be needed on the part of the individual?
So some of our services are by donation. Other services will charge the insurance. Some services are free. Like for instance, majority of the kids who get immunizations, especially if they have Medicaid, the state provides immunizations for them for free. So then that's called vaccines for children. So these kids will get immunizations for free. So if we take our show on the road, those kids will have vaccine for children for free. If you have commercial insurance, most insurances pay for vaccinations. There may be some copay for some people for that, but it will be similar to that what you would get at a doctor's office if you had to pay a copay there. So it wouldn't be any different. But like our COVID-19 testing that we have is free. So it just depends on the services. Some services will cost more than others. But we will let you know before you even get them done if you have to pay any money or not.
Okay. So now you gave out a website here earlier, so where people could go and get information. What was that website again that you gave out?
Go to the Saginaw County website. Just put Saginaw County Health Department in the search engine, and I'll pull up our website, and then you'll see where it says coronavirus. Click that information, and you'll be able to see that. Also, cdc.gov is another place where you can go, and you just put in their search engine coronavirus. You'll find everything you want to know about coronavirus. You can put coronavirus and kids, and it'll tell you about kids. Coronavirus and disparities. So you want to see like what are the disparities of coronavirus. You can see how many African Americans versus Hispanic Americans, all kinds of different people in the United States. You can find that out. So when you go to the Saginaw County website, ours is for only Saginaw County. The state of Michigan is for Michigan. The CDC is for the government, like the whole USA.
Right. Okay. And see, it's just popped up there, SaginawPublicHealth.org. You can go there and get all the information. So, man, we've covered a lot here. And Dr. Pruitt, once again, thank you so much for joining us. And so I guess what would be the one takeaway from this? And probably, I guess we can't say one. There are probably several takeaways for people, and just with COVID-19, because this is just a new way of living. A lot of people are just so overwhelmed. There's just so much information out there. But what would you say to people? What would be the takeaway from all of this?
I think, first of all, we want you to know that this is a persistent virus. And so I think a lot of times, like you said, people just were weary of dealing with it. Like they want it to be over and done with. And there's a certain sense of, I'm just tired of dealing with this, right? You have to, it's okay to be frustrated by it, but you have to think about, if you just give up and just say, I'm going to start living my life like normal, and then you take it home, you yourself die, or you take it home to the people that you care about, it's not worth it. You still have to be persistent, diligent, to go back out there and do those 3 W's that we talk about. Wash your hands, wear your mask, watch your distance. Because I think fatigue sometimes makes people just not care anymore. And then they say, I'm just going to just, go out and do what I want to do. You guys, because of these disparities that we're dealing with, because we know that Black and brown people are dying at a higher rate, we have to do our part to make it better. And I think if I could say number two is we have to deal with these chronic conditions that we have in our community. You
Mhm.
know, most people, if you're on high blood pressure medicines, especially early in the disease state, you could come off those medicines if you ate right and exercise. For diabetes, you could come off some of your medicines, maybe. You may be able to be what we call a diet controlled diabetic, but just by eating right will make a big difference in exercise. So let me just say it again. You want to exercise 30 minutes at least 5 times in a week, or a total of 150 minutes in a 7-day time period. And guys, it doesn't have to be like all 30 minutes at one time. You could do 10 minutes, 10 minutes, 10 minutes, 5 minutes, 6 times throughout the day. And like Yvonne and I was saying, which is funny, like we like to park far away and walk all the way into the grocery store. That way you can get some extra steps in and things like that. And you just integrate that into your everyday life, because we got to start moving more and eating better if we expect for us to be doing better. A lot of people think that COVID-19 is a disease for African Americans, and it really isn't. What it is that we have more chronic conditions, we're more on the front lines, and sometimes we live in close quarters, and it could put us at risk. But there are things that we can do to decrease our risk, and that's what I was just talking about: exercise and diet. And I realized, Yvonne, that losing weight is probably one of the hardest things that I have had to do in my 40s. I understand. Like I tell my patients all the time, I'm not talking about you. I'm talking to myself too.
Right.
I just lost 35 pounds. And so it's been a struggle for me. How busy I am, the 4 kids I have a husband, I got, a couple of jobs. I'm doing a lot of things. But this is really important. This is the time to stop and say, out of all the things on the list that I have to do every day, self-care, taking care of yourself, people in our communities, Black and brown communities, stop, put yourself on the list, take care of yourself so that you, one, prevent the chronic illness, two, control the chronic illness so that it won't get worse.
And you don't have to do all these things. I mean, it's great if you can do it all at one time, but if you just start with just, okay, well, I'm going to walk 10 minutes, 15 minutes.
10 minutes.
I'm not going to eat, 3 pieces of fried chicken, today. I'm going to eat just, increments, and it will build up and
build up
difference. Yeah.
You guys, I asked myself a question. That's the first thing I started with. I'm a cookie monster. I'm like everybody else. I started with, do I have to eat 4 cookies? That's the question I have to ask myself. Maybe if I just ate 3 cookies, this would be better. And so you don't have to start off with like, I'm just going cold turkey and I'm just not going to eat anything bad. No, start with, a lot of times it's just sweet drinks that gets people, right? So you got your Coca-Colas and your Pepsis and your Kool-Aid and whatever else. Start with just something small like that. You'll be surprised. I knew a person who just said, okay, I'm giving up Kool-Aid, lost 20 pounds.
Wow.
Kool-Aid alone.
Yep. Yeah. A lot of sugar, a lot of stuff in there.
Sugar.
Tastes good, but
Tastes good. I mean, you're drinking calories away. So those are some of the things that if you could just make a small baby step for yourself, like what present or gift would you give yourself for yourself? I think that's a good start.
Well, gosh, it has been so. I could talk to you for another 30, but we got to wrap this up now. But if you would please share this as you're watching, you can share this. You can also watch the replay on our KISS 107.1 Facebook page and our KISS 107.1 YouTube channel as well. So Dr. Delisha Pruitt, the medical director for the Saginaw County Health Department, thank you so much for just staying in the fight and fighting the good fight. And we're going to get through this thing, but we definitely have to do our part to do it. So thank you so much. I do appreciate you. And we're going to wrap this thing up. So you have a great day. Okay.
Bye-bye.
Bye.